Now to major developments in the search for a COVID-19 vaccine. Governor Ducey saying he expects a vaccine, once approved, will be on the ground in Arizona by late December.
And while this may sound like a light at the end of the tunnel, we know Arizona still, of course, has a long way to go. We just passed 300,000 cases since the pandemic began. Several hospital metrics also on the rise.
ABC 15's Nicole Grigg is live. And Nicole, at least tonight, we have a sign of hope.
It really is, but one doctor I spoke with says a vaccine itself will just not be enough.
The way I describe it is that I did it for humanity.
Frank Apodaca is currently going through a vaccine trial for COVID-19, and he shares with us what it was like to receive it.
You know, when you get a flu shot, you might feel a little tenderness, what have you. Didn't feel a thing until about the following day, evening. And then my shoulder started feeling sore. I'm like, no, didn't think anything of it. That evening, I started getting a headache. The following morning, I woke up and I had like body aches.
No major reactions for him. And with the news that Arizona could have the vaccine in weeks, there's a lot of questions like who will pay and who will receive it first. The draft copy of the Department of Health's distribution plan has healthcare personnel at the top, followed by other essential workers like teachers, people with health risk, and those in long-term care facilities. Then at-risk populations like minorities, tribal facilities, and those in prison or homeless.
We're giving it out to healthcare workers and seniors in nursing homes first because they're the most at risk. They're the ones exposed or they're the most likely to die. If you're a young adult with no health issues, you're probably not going to get sick or have as high a risk of mortality. You're probably going to get the vaccine, we're guessing, end of first quarter of next year, so maybe March or April.
Dr. Andrew Carroll is one of the providers who have completed the process to get the vaccines first. He's waiting to hear when he could get them. We asked him about who will pay.
The government is covering the cost of the vaccine itself. Well, no one's being expected to pay for it, and as a matter of fact, we're mandated to give the vaccine to anyone who wants it within the priority group. So if you're insured or uninsured, you're going to get the vaccine.
But even with a light at the end of the tunnel, Dr. Carroll says a vaccine won't be enough by itself.
The vaccine is one of our mitigating efforts, but it's not the only one. And remember, it's 2 shots before it becomes effective. So the very earliest that we're going to be protected is February, March, and that's going to be a very small number of people.
I did ask the governor's office if they know what vaccine, what company will be hitting the ground in the coming weeks. However, we did not hear back. Reporting live in Phoenix, Nicole Grigg, ABC 15 Arizona.